Hi, I'm excited to have with me today Dr. James Collyer. He's the co-founder of Modern Dermatology with me. He's a fantastic dermatologist and all-around good guy. And today we're going to talk about aesthetics, in particular aesthetics in men. And this is a area of growth for all of us, but Dr. Collyer in particular is really sought out for his very natural results in the treatment of men. And I wanted us to get a chance to talk with him about sort of the way he approaches aesthetics in men.
Well, it's very interesting because even over the time I've been practicing, I've seen a lot more men who are seeking aesthetics. And I think as time has gone on, it's becoming more socially acceptable, not so stigmatized.
But they still don't want to look like they've had anything done.
No, they still don't want anyone to know that they've been doing it. They don't want any of their friends to know, that's for sure. But generally when men come to me, they will often want to be asking me aesthetic questions, and it just kind of comes up in the conversation as we're discussing skin and their face. It's pretty exciting. The most common thing for men that I'll recommend is the proper products and proper skincare. But the most common procedure
of course.
Oh, of course, Restore, yes. And the most common procedure, though, without question, is Botox. So Botox has been around since 1989, technically. Lots of safety studies on it. And what Botox does is it helps decrease lines of motion, so fine lines and wrinkles. So forehead, crow's feet, in between the eyes, called the 11s. Those are the most common areas to treat. And the good thing about Botox, despite what Saturday Night Live says and the stigma associated with it, you can have very natural looking results that make you feel great about yourself, make you look great, and make you age more gracefully. It's really important to discuss this with a board-certified dermatologist because the face is full of all sorts of different muscles, and you want someone who knows what they're doing in order to do that. So there are different ways to slow the aging process very naturally, and Botox is certainly the most common. Everyone loves it.
So 2 questions.
Yeah.
One, when I see men, very rarely do they ask me about Botox. They'll say, my wife or my partner wants to know if there's anything I can do about this. They don't actually ask outright. They're more like, someone suggested I bring this up. So I'm sort of curious, when it's a man talking to a man, is that the way it goes down?
Often it goes down that way, and it's so funny because most of the time it's like my girlfriend, my wife, these bother her, and they don't bother me, but they bother her, so what can I do about them?
Yeah.
And so that's often how the conversation starts. Sometimes they look at my forehead and they say, hey, you don't have a lot of wrinkles on your forehead. and so it's really actually nice for me to have experience in order to share that with them, but also, I've been injecting Botox for over 15 years, so.
So then what do you do, when you look at a man, particularly because of the concern of not wanting to look done, not to have a feminization of their face, how do you approach them the first time to sort of ensure that they get a good result?
Well, evaluation is really important, the initial evaluation. I have patients animate, have them move the muscles, I look at their facial structure, I look at their muscle structure, and I just ask them what bothers them. I'm not going after, I'm not gonna, I want to do what the patient wants and what they want to correct. It's not about what I want, and it's really about what bothers the patient and what we can do to help correct that. So everyone's very, very different. That's why the evaluation is so incredibly important. And then we can have some pretty awesome results.
Yeah, and I think one of the things that James and I both do is we undertreat the first time. We don't want people to feel frozen. We want them, oftentimes they come back at 2 weeks, and we can always do a touch-up to make sure they get a better result. I think it is important for men to know that they have bigger muscles than women, so oftentimes they need a higher dose. On average, what are you dosing for a man who wants his glabella and his forehead done? Usually where is that?
Well, so an important thing too is the differentiation between men and women, but also amongst men. I have a, I would say, moderately muscular forehead, but there's some guys that have Neanderthal brow, and there's other guys that are very, very thin. So it really depends on muscle structure, but anywhere between 20 and 24 units for men in between the eyes. And
then women, you can really get away with 12 sometimes. So this is a significantly higher dose, which you need to get a good result. And more doesn't mean it's going to look fake. Sometimes more means it's going to look more natural because you don't have some muscles moving that shouldn't be moving.
And then another thing too is you want to make sure that you're injecting, I agree with you, less is more. especially in Seattle.
Yes.
But it's better to look natural, and men want to look natural. They don't want to look frozen. But it is very important to know facial anatomy, because you can put a little in the forehead, but if you put it too high, you're still going to have wrinkles down below. So it's really important to know that anatomy of the facial structure, so that when you're treating them optimally, and not too little or not too much.
Exactly, and it's important that people see someone that they feel comfortable talking to. And I think this is some of the feedback that we get at this office, is that if it's not exactly what you want, it's really easy for us to get there if you tell us sort of what you're going for. And I think a lot of people sometimes have their first Botox experience not be what it could be, because they're not going someplace where they're able to have a conversation with their provider about what's achievable and what's not achievable.
Something else important is that this is your moneymaker. This is your face. It's a very important structure, and so you want someone working on that who knows what they're doing as well. I mean, you can, some patients ask if they can, if a Groupon for $10 a unit at the, nearby spa is worthwhile, and it's your face. You have to make sure that you're treating it correctly by someone who will treat it correctly.
And on that note, I'm going to wrap up with great advice I got from one of my girlfriends: is you don't skimp on cosmetic treatments or childcare. Thank you, Dr. Collyer.
Yeah.
That was super fun.
Okay.